Hi everyone, my name is Ezekiel Aaron and I'll be doing a presentation for Intro to Neuroscience 8310. I'll be speaking about Parkinson's disease and more specifically I'll be talking about the focused ultrasound treatment for Parkinson's. Now anyone that knows me will tell you that I love to talk, I'm a bit of a yapper, and I will speak at length about any subject that catches my interest. However, for the sake of brevity for this video, I will be sticking mainly to the scientific information that I deem to be most relevant to the topic which I'll be discussing today. With that being said, any additional information will be provided in the description for this video, citations, as well as the full script for this video, which contains some footnotes. Without further ado, alright, let's start off with a question. What exactly is Parkinson's disease? Well, according to the MSD manual, Parkinson's can be defined as a slowly progressive degenerative disorder characterized by resting tremor, stiffness, slow and decreased movement, also known as bradykinesia, and eventually gait and/or postural instability. But what does this mean exactly? Well, what this definition is trying to convey is that Parkinson's is a neurological disorder that does progress slowly, but the symptoms do get worse over time. So it is characterized by tremors and stiffness of movement, with the tremors usually starting out in the hands, but those tremors can then progress to other parts of the body, as well as that stiffness transitioning into a general inability to move in the way that one might want to move, as well as gait and postural instability being a general inability to transition from a resting position to a standing or walking position, as well as maintaining that balance once in a standing or walking position. Okay, so now that we know what Parkinson's is generally speaking, how does it affect the system on a neurological level? Well, again, according to the MSD manuals, in Parkinson's disease, pigmented neurons of the substantia nigra, locus coeruleus, and other brainstem dopaminergic cell groups degenerate. Loss of substantia nigra neurons results in depletion of dopamine in the dorsal aspect of the putamen, part of the basal ganglia, and causes many of the motor manifestations of Parkinson's disease. So already we can see why Parkinson's disease would have such a drastic effect on somebody's ability to control their motor functions, right? The basal ganglia makes up a part of the central nervous system that is directly responsible for movement control, as well as the substantia nigra, which is part of the basal ganglia circuitry. But more than just that, the substantia nigra is also responsible for critical dopamine production within the central nervous system. Now, dopamine, just as a refresher, of course, is a neurochemical that does a lot of things within the central nervous system, from emotional regulation in the limbic system to movement control. Eventually, advancement of the disorder may lead to knock-on effects in people experiencing Parkinson's disease. Difficulty chewing and swallowing food may lead to weight loss. An inability to move in the way in which a person might want to may lead to difficulty grooming and caring for oneself. People who experience Parkinson's tend to overwhelmingly be over the age of 40, and the disease progresses well into their elderly years. So somebody who is experiencing Parkinson's may require more care and attentiveness from the people around them than somebody ordinarily would at that age. Additionally, Parkinson's disease is somewhat linked to dementia, with there being a specific type of dementia for people who have experienced motor-related symptoms of Parkinson's disease, commonly known as Parkinson's disease dementia. Okay, so here we are. I know I said I wasn't going to talk too much, but I can't help it. I'm a yapper at heart. So with that being said, let me tell you a bit about myself. I swear to you, I promise you, it is relevant. When I was about 9 or 10, I went to go live in Trinidad and Tobago with my dad and my grandparents on my dad's side, of course. At the time, my Nana, she was about 64 years old. She was capable of doing everything that someone of that age would be expected to be able to do at, a reasonable level. She could drive, she could walk, she could sit stand like any old person, just a little bit gingerly. And she was no spring chicken, but she was capable of doing these things. So as the years progressed, I noticed a change. She had developed more pronounced tremors in her hands, and then they eventually spread to other parts of her body. She now had more difficulty doing everyday tasks, even needing help standing, and couldn't stay on her feet for long periods of time as well. She would require more and more assistance as the years went by from myself as well as my father and my grandfather. And of course, as you probably guessed by now, it was explained to me soon after I began living in Trinidad that my grandmother, of course, did have Parkinson's disease. And so, of course, we would have to be more attentive to her and more aware of what she would need on a day-to-day basis. She would, of course, require more assistance than the average person. Now, of course, that is a bit about my experience as somebody who was a family member of somebody who has Parkinson's. But in terms of being a caregiver, my grandfather would, of course, be the real expert.
Well, I think that we really noticed it about 16 years ago. So she would have been age at the time 62.
Right. So, and what were the initial symptoms that you noticed?
The initial symptoms, I think, were slight tremors, mainly that.
Yeah.
I think it was there. It was at that Chicago doctor that she was first diagnosed. So, but at that time, although I said she was diagnosed, it really was not. It was not severe,
Right.
We were just conscious of a positive diagnosis for Parkinson's.
And as the time progressed, did you notice worsening in the symptoms as well as I mean, you of course noticed that, but how severe did the symptoms become?
Well, it started off, I think, with her first having the tremors, and then little mobility issues in walking. She was not as steady as she used to be, because you know that she was a very active person, very active walking,
Of course.
driving, and so on. So I have to say that it progressed very gradually.
Mm-hmm.
It progressed gradually but constantly, and eventually we started visiting the neurologist down here. He introduced us to Dr. Daniel Jamino. They were pioneering focused ultrasound specifically for Parkinson's.
And you mentioned previously that there were some difficulties with the procedure. Could you elaborate on that a little bit?
So we did the preliminary test. They did videos of her mobility, some special exercises they wanted to see. This is in advance of all going up there. They also wanted to see some of the scans that were done, or some sort of imagery that was done over here before, so they could confirm what sort of approach they were going to take. So we did all that preliminary work, and then we were invited up to Switzerland. At that time, they had done something like 500 procedures, or of varying intensities, with very good results. They went through with us. They tried to give us an understanding of what contributes to the Parkinson's condition in terms of the various parts of the brain, and how they were going to approach it. Right? They were very thorough, very professional, very sophisticated. And of course, it would cost a lot of money, but so that was done on the first day. On the second day, they prepped her for the intervention, which is putting all they shaved her head, and then they put all the various electrodes and so on where they wanted, and then they took her in. But after a couple of hours, she came out, and there is something like a nursing home within the clinic itself where the post-operative evaluations are done. So they took her across there, and they had a meeting with me, and they said, they were in uncharted territory because they did not realize that her bone density was that the cranium density was so high, and to penetrate it, they had to use higher temperatures, which made it uncomfortable for her. And she was obviously in some discomfort by the time we got to her. They said that they did do some work, but that it represented probably only 50% of what they would have liked to have done, and that we should monitor the situation and return within 6 months. But having gone, it was a bit stressful, and all the traveling and the operation. It was stressful on your nana, and we decided that we would not repeat it. We would just continue to go on the medication, which is cinnamon.
There are several different methods available for treating Parkinson's as well as its related symptoms, with the first and most common being, of course, the pharmacological route. This is where drugs are prescribed to the person who is suffering from Parkinson's in an attempt to raise their dopamine levels and try to mitigate the effects of the symptoms. The most common of these drugs would, of course, be Sinemet, which contains levodopa, which the brain can absorb and convert into dopamine. Another method of treatment is deep brain stimulation, or DBS, wherein electrodes are implanted into the regions of the brain responsible for motor control in an attempt to stimulate some form of symptom relief. However, of course, the method which I found the most interesting and the one that is the topic of this video will, of course, be Focused Ultrasound for Parkinson's. Now, this is a magnetic resonance imaging guided procedure in which they utilize ultrasound beams in order to create lesions in the areas of the brain which are afflicted. Now, of course, there are other surgical procedures which aim to accomplish the same goals as the Focused Ultrasound for Parkinson's. However, the difference between those procedures, for example, deep brain stimulation and the Focused Ultrasound for Parkinson's, is that the Focused Ultrasound for Parkinson's is completely uninvasive. That means it does not require, cutting the person open or using any sort of surgical tools in order to accomplish symptom alleviation. This may appeal to individuals who are somewhat wary of invasive procedures in general. With deep brain stimulation, it is somewhat reversible, and of course you do need to reprogram the device every so often in order to find maximum benefit for symptom relief. With the Focused Ultrasound for Parkinson's, there's not the need for repeated adjustment or anything of that sort, but it is permanent and irreversible. The Focused Ultrasound for Parkinson's is also a fairly novel procedure, with it only being FDA approved for implementation in 2016. And so the sample size is quite small. Due to how new the procedure is as well, there are also some limiting factors, such as the fact that it can only be done to one side of the body, as the FDA has not yet approved its use for both sides, as damage may occur to areas of the brain that are responsible for speech. Additionally, according to a paper done by Kyle et al., which is cited in the description for this video, there does seem to be some correlation between a patient's skull density and the expected efficacy of the treatment itself. Now, what that means is that essentially, with regards to Focused Ultrasound for Parkinson's, as well as many other Focused Ultrasound treatments, if a patient's skull density is too high or just doesn't fall within the preferred range for the treatment itself, then the ultrasound beams may not be able to permeate the skull effectively enough to create lesions in the areas where they are needed. And of course, this was mentioned by my grandfather earlier. However, most patients do report back some level of satisfaction after undergoing the procedure, as well as a reduction in tremors, at least to that side of their body. In conclusion, I think that the Focused Ultrasound for Parkinson's is such a crazy idea, I can't believe someone actually thought of it. I mean, just the idea of using an MRI machine to laser focus, a ultralight beam into someone's head, specifically the areas of the brain that are responsible for the symptoms of Parkinson's. It's just crazy to me. But I definitely am looking forward to seeing what developments are made within the next few years with regard to the procedure. Alright guys, thank you so much for watching my video on Focused Ultrasound for Parkinson's. Thank you so much for your time. Let me know your thoughts on the procedure. Do you love it? Do you hate it? What would you rate it? Alright, peace out.